Now, coming today, we have got Dr. Soumya Lanka. We met her in the previous topic of skincare. Hi, Soumya. Thanks for coming once again to the channel.
Hi, hi
How are
Raj.
you?
I'm fine, thank you.
Okay, we would like to know more about the hair care and we would like to get the insights from you regarding the hair care, Soumya. Now, coming and jumping straight into the topic, what is the fundamental importance of hair care in maintaining the overall hair care? I'm not the person to be asked because I don't have anything up north over there. But anyhow, I will ask for the general public and for my knowledge as well.
Okay, I mean, taking hair, the care of the hair is really, really important. But at the same time, sometimes it's extremely difficult because you can't fight with the genetics and the stress. So, what your parents have, you will be imbibing those genetics from them. So, I mean, you can do a lot to maintain the hair, but
Okay.
you can, if you don't take care of it, yes, you're going to lose it much quicker than when your parents had the hair loss. So it'll be much more quicker that the hair goes.
All
So I
right.
would say the amount, it the most important thing is what you eat is what your body eats. So
Okay.
when it comes to hair care, eating the right food is also important, and what you use as shampoo and conditioner plays a very big role as well.
Okay. All right. Okay. Now, can you explain the basic structure of the hair and how proper care contributes to its strength and its vitality?
Okay, so let me just show you. This is like a hair structure which I have. I'm not too sure whether that is clear, and can you see that at
Yeah,
all?
it's perfect. Yeah. If you can slightly lift it up, please. Yeah. Yeah.
Okay, so can you
Yeah,
see that?
fantastic. Yeah, that's fine. Absolutely fine. Yeah.
So that is the hair coming out from your dermis. This is your epidermis, and that's the whole thing is your dermis. So your hair follicle is in the deeper part of the dermis, basically. So and then you've got different structure to the hair. So the outer lining is the melanin, which goes through. This is a hair follicle, basically. So the hair, if you take the hair structure itself, it's got the cuticle, the cortex, and the medulla inside. So
Okay.
the most of the things which we apply is mainly to maintain the cuticle, basically. It's not even, it doesn't, because the cuticle is the main area you want to kind of support the hair with. Okay.
Okay.
So if you are a person, again, the scalp is also a major organ, the
Okay.
follicle is a different organ. So I
Okay.
always explain to people, like, for a plant to grow, you need a good fertilizer, sunlight, and water.
Okay.
The same thing for your hair. The hair follicle needs to be right, so you need to stimulate the follicle. The scalp needs to have the good nutrition, and your scalp needs to have a good blood supply. So those three things are so important. So you need all of it to be addressed to handle the hair. So it's almost like you need to eat healthy to get the fertilizers in your scalp. I'm just saying fertilizer is just a scalp health. And you need to clean the scalp regularly, no dandruff and no dryness, and no excessive oiliness as well is not the greatest thing for your scalp. So,
Okay.
and comes the follicle, which is genetically dependent on how your parents had the what they passed on to you. So
Okay.
the follicle plays an important role. So the follicle miniaturizes as we get older, or it goes into the different cycle when you get stressed, when there is hormonal changes, menopause, puberty, childbirth. There's a huge range of things affecting the scalp follicle. And
Okay.
I think now the most of them who come to the clinic for us are those affected by COVID. Post COVID, inflammation of the hair and hair fall has become
Okay.
a very, very big thing for us to deal with. Okay.
Okay.
And the next one is your blood supply. The blood supply is equally important. That's why our ancestors told us about the massage techniques and
Massage.
everything for the hair. But at the same time, you need to have the blood vessels which are healthy on the hair as well to increase the blood supply.
Okay. So, what are the primary factors that can lead to hair damage, and how does a consistent hair care routine help mitigate these issues, Soumya?
So it's again coming back to the three fundamentals. Again, the hair, scalp being healthy itself, okay, and the follicle being healthy and the blood supply. So if you think about protein intake, so we all are well fed when our parents are looking after us, but after some time we tend to because of work and stress and the career, everything. So we don't. I mean, some people are very good in taking consistent protein intake in their diet, but one thing to forget is like we have 3 meals a day, and that needs to have protein, at least 30% protein in the food. So with
Okay.
3 meals a day, I'm not too sure. I can say I struggle sometimes to get that amount of protein
Yeah,
in.
that
So
typically
that
with our Indian nutritional habits, the protein intake is damn less, I would imagine.
yes.
Yeah.
So, but then again, if you think about your hair, it's nothing but protein. So that is the fundamental important thing that we need to make sure that we're getting it in our diet. And again, stress is a very, very common thing. And if you can try and do something about it, it's well and good. But again, that miniaturizes the hair all the time. So supplementation is another way that you can handle the hair damage as well. So there's some supplements which you can take over the counter, biotin, omega-3, probiotics. And if you have any medical problems, for example, thyroid, low iron, and vitamin D deficiency, so all of these contribute to hair loss or thinning of the hair. So you want to try and deal with hair loss quicker before the follicle miniaturizes and gets destroyed. Once the follicle is gone, it's gone. You have to get the follicle or have a hair transplant to get the follicle back. So key importance is you need to treat the hair problem very quickly before it is lost the follicle.
Fantastic. That covers beautifully. You talked about the macronutrients in the form of protein, and micronutrients wise, you were talking about iron as one of the key factor. Uh,
It's
so
iron, biotin, there's omega 3 to decrease inflammation, which happens in our body every time you get stressed. And there's also vitamin D, which I think most of them will be vitamin D deficient in this in UK. Because again, the sunlight and everything plays a very important role with vitamin D as well.
all right.
And yeah, so that's important. And again, if you think about the shampoo and the hair products we use, it's so important again to know about the water we use at the house. Again, hard water, soft water, and also how much your hair has been damaged because of heat products, the styling products that we use. All of them make a very, you know, important, they really play a very important role. So we go into the details of the history, whether it's genetic or whether it is, everyday pressures in life which is doing it, whether it's your eating habits which is doing it, and the simple things when you exercise, whether you wash your hair immediately, all of that matters a lot.
All right. Okay. That's very helpful to know. So, in your opinion, uh, you covered it mostly, but how does a person's lifestyle and daily habit has an impact on the health of their hair?
So, if you're a person who is able to consume proteins, good proteins every day, and if you're able to keep up your and regular blood tests, okay, just to make sure if you have thyroid problems, iron deficiency, vitamin D, B12, all of them are kind of folic acid, all of them are good in their diet. So, it's what you consume basically. And having a good exercise is also important. But again, the testosterone, if you have your parents passing on the genes to you, you cannot do anything to minimize that. So you have to go on to something like medications which might help you to prevent that follicular downregulation or the follicular miniaturization. So
You
we
mean
do.
medications?
Yeah, we do. We do have medications as well that we give. So some of them are hormonal, some of them are non-hormonal. So the
Okay.
supplements which I mentioned to you, they're very good. And there's something some people can start using minoxidil over the counter, which is a
Yeah.
balance, which is 2% for females and 5% for men. That
Okay.
helps a lot as well. So, but it's regular use of it, not just using it for a couple of months and then stopping it and then restarting. And but minoxidil is only acting on the blood supply, so it just increases the blood supply. It does nothing to the follicular growth or anything. So when it comes to follicular growth, this again you have to think about microneedling with stem cells, exosomes. There's quite a lot of exosome topics at the moment, and also about PRP, which is a very natural treatment, which is your own body platelets are taken and centrifugation is given to your scalp back as an injection. So,
All right.
so there's loads of things that are happening, so which can help you to minimize the hair loss. Yeah.
Right. Okay, that's interesting. Okay. So, what role do different hair types, say for example, a straight hair or a curly hair or a wavy hair, play in determining the most effective hair care routine? Is that anything of scientific thing at all, or it doesn't matter much? Any kind of a hair, it's all norm.
No, because hair is very individual. You know, it's like a product, if which works for you may not work for the next person at all. So again, if you think about a wavy hair, if you want to make it straight, you have to break the disulfide bonds in the hair. And once it's broken, it's extremely hard to get that disulfide bonds back again. So you have
Okay.
to work on repairing it afterwards. So preserve your hair type, but I think most of us, if you have a curly hair, you want to go for a straight hair. You have a straight, you want to try and make it wavy. So I think most of us try and experiment with the hair, which I would say is okay in certain types of hair. If you have a thick hair, okay, then you were willing to experiment and experience a bit of hair loss, which comes as a part of it. But
Mhm.
again, if you're blessed with curly hair, it's better to take care of your curly hair with
Okay.
good moisture. Again, using a proper shampoo and a conditioner is a must. And a leave-in serum is also very important to make sure that the cuticle is kind of taken care of. Because once the cuticle goes, it's extremely difficult to get the cuticle back again.
All right. Okay. Right. Okay. Now, since that we are on this particular topic of hair care, can you touch base on hair transplant? Is that your area of interest, or uh, what is your advice regarding hair transplant and stuff like that?
Hair
What are the?
transplant is, I don't do hair transplant. It's Raghu, that's Dr. Raghu Lanka, who does hair transplant. He's my husband. But I do triage patients for him. So basically, again, hair transplant is for people who have lost the follicle. So this is first of, there's loads of people where they want to get the hairline down. If there's no follicle, then you have to get the follicle from somewhere else. We also do eyebrow as well, eyebrow transplants. So
All
beard,
right.
you can do anything, but again, it's the acceptance of that follicle in that transplanted area depends on how healthily you are taking care of the particular area as well. So you need to make sure you need to go for a place where you're taking it. If you know, if a single follicle can grow about 4 different hairs from there. So,
Oh, all right. Okay.
so a
Buy one
follicle.
get four free.
Yeah, if you think about it, this is a follicle. Okay, so it's not that it's only one hair coming out of it. You might have two, three, or up to four from a single follicle. So if the follicle is quite healthy, then obviously you'll get more number of hairs coming out. So
Okay.
that's how. So we go for where the follicles are rich with a number of hairs. It's usually on the back strip.
Yeah.
So we take most of the hair transplant follicles from there. So you might get two, three, four. So it is kind of transplanted from there to the front of the scalp or wherever you want it to go through.
Mm.
And the process is, again, once you've done it, it doesn't mean that it's a permanent process. No, there's nothing permanent about hair care, or the hair loss starts after. Again, because however long testosterone is in your body in case of men, or the hormones in case of a female, even females do have testosterone that has an ability to act on the follicles. So you will still need to do something to make sure that the follicle is healthy. Otherwise, it again miniaturizes and it's going to die again.
That's pretty good insight, Soumya. In conclusion, uh, for someone with a busy schedule, what are all the essential and time efficient hair care practice that they should incorporate in their routine, Soumya? To summarize and to consolidate.
I mean, I would say if you can wash your hair twice a week is what we advise you to. Again, eating healthy, exercising properly, and washing your hair after the exercise is also important. When you wash it, I would always say it's better to leave something on your hair because remember, water on the hair shaft or the hair itself can be damaging. So you need to make sure the cuticle is trying to, you need to relax the overwhelmed cuticles basically. So you need to make sure that the old say about using coconut oil before, maybe a half an hour to an hour before you go to the shower. That's quite important. And after that, using the right kind of shampoo and a conditioner after that is also a must. But again, what conditioner and what hair shampoo is a very big topic by itself. So
Okay.
that's something that we can talk about another time.
Yeah, we will talk about on another day. It might be out of purview of this particular one. Otherwise, it's going to go long and people will get bored. So, Soumya, I couldn't thank much for you coming over here and passing your insights and your valuable knowledge to all our audiences here. I really appreciate it. And I will look forward to seeing you in the next session of menopause, whenever time permits, for you to give us the insights about it. Thanks, Soumya.
Thank you. Thanks.
Fantastic. Thank you.